Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of April 13th, 2023. This week, I'm going to talk about a topic that's pretty important and been in the news, and that is what is the latest on autism spectrum disorder? It's been in the news a lot, largely because of a new report from the Centers for Disease Control and Prevention that reported that today they estimate that 1 in 36 children at age 8 has been identified with autism spectrum disorder. And this is important because the percent of kids born or identified with ASD has been increasing significantly. So 20 years ago, at the beginning of the current century, we were seeing about 0.67%. The number has been increasing with just 1 year going down, such that over the course of the last 2 decades, the percent of kids born with autism spectrum disorder, diagnosed with autism spectrum disorder, has quadrupled. It's about 4 times more common in boys, but now for the first time, 1% of girls in the United States have been diagnosed with autism spectrum disorder. So it raises a couple of questions. One of them, what is autism spectrum disorder? It's a developmental disability caused by differences in the brain. It affects how people behave, communicate, interact, and learn in ways. They do it in ways that are different from other people. So I like to say that they differ in how they receive, perceive, and respond to external and social stimuli. According to the Diagnostic Statistical Manual, the manual that helps people diagnose psychiatric, behavioral, developmental type problems, people with autism spectrum disorder typically have difficulty with communication and interaction with other people, restricted interests and repetitive behaviors, and symptoms that affect their ability to function effectively in school, work, and other areas of life. Looking at those specifically, in terms of social communication, interaction with others, there are a lot of behaviors here. I'm not going to read them all, but you'll see making little or inconsistent eye contact, appearing not to look or listen to other people who are talking, displaying facial expressions, movements, and gestures that do not match what's being said, difficulty adjusting to social situations, difficulty adjusting to change, and so on. In terms of restrictive and repetitive behaviors, repeating certain behaviors such as words called echolalia, getting very interested in specific topics and really focusing on them. They also report that children with ASD may have sleep problems and irritability, but it's also important to point out that people on the spectrum can have significant strengths as well, including some that excel in math, science, music, art, and so on. Now, typically in medicine, when we think of a spectrum of disease, we think of it going from more severe to less severe. And that's true with autism, but autism is more complicated than that. I think at its simplest, you can think of autism as having 2 spectrums. One, more social limitations, more social disability, if you will, all the way up to less. Some kids with autism are nonverbal. Others can carry on reasonably normal conversations. But the other spectrum is some have really exceptional ability to learn, ability to really memorize issues. But I actually think it's even more complicated than that. I think really to think about ASD, we have to think about multiple spectrum. So, for example, verbal versus nonverbal, ability to adapt to change, irritability versus non-irritability, exceptional strengths, and so on and so forth. So when you think about all of these different areas, each person will fall in a different place on each of these spectra. And that is in part why we see such a wide range of kids who carry a diagnosis of autism spectrum disorder. Now, there are 3 broad unanswered questions about ASD. One is what causes it, and the bottom line is no one knows for sure. The best information seems to be that it's a combination of genetic environmental and biological factors. There are some situations where the risk seems to be greater. This is not causal. I'm not saying this causes it, but the risk is greater if there's been a sibling with ASD, certain genetic or chromosomal differences and complications at birth, and being born to older parents. The National Institute of Environmental Health Sciences goes a step further, talks about advanced paternal age, that's father's age, prenatal exposure to pollution or certain pesticides, prenatal meaning before birth, maternal issues, including potentially immune system disorders, extreme prematurity or very low birth weight, or any birth-related activity that leads to oxygen deprivation. But all of these factors are associative and not causative. None of them are felt to be purely causative on their own. They increase risk. So probably at the end of the day, when we know more about this, we're going to say that there's a genetic predisposition and some environmental exposure. And the reason I have environment in quotes is the environment can be in utero when mom is pregnant with the baby, or it could be something exposed. It could be something that mom is exposed to while pregnant, or something the baby's exposed to shortly after birth. But it's really, really, really important that we don't rush to judgment. We've all seen the damage that was done by the implication that childhood vaccines caused autism. That has been significantly disproven, and whether it was said with, in good faith or not, is less important than the fact that it caused many people to question the value of vaccines, and has had a significant negative impact on the public's health. So we want to make sure that we don't rush to judgment on what might be causing or contributing to autism. We really need some large-scale studies. But now with the access to data, these studies may well be possible. The second unanswered question is autism spectrum disorder becoming more common, or is it just being diagnosed more frequently? The official word, at least until recently, was that it's simply being diagnosed more frequently. I have to tell you that just for me, I question that. I look back in the early 80s when I was doing my training in pediatrics. We saw very few kids, if any, that would meet the diagnosis. And I remember back then when someone I knew had a child that was diagnosed with autism, I remember being perplexed, surprised. It just didn't seem likely. Now it's widely 1 in 36 or so births. So again, it's unclear whether it is simply being diagnosed more frequently. I suspect we're going to find that it is in fact increasing in frequency. And the third and final question about autism, is there a cure or treatment? Unfortunately, the answer is there is no cure, but there are some interventions that can help. And there are these various treatments are really designed to maximize a child's ability to function by reducing the symptoms and allowing to support the skills that the child has for social interaction. And early intervention in the preschool years can help a child learn critical social communication, functional, and behavioral skills. So there is no cure. Again, this is probably a medical condition that is caused by how the brain is wired, if you will. So there's not going to be a cure, but there are going to be mechanisms to maximize the strength that each child has. So if you have a suspicion that you may have a child with autism spectrum disorder, please seek qualified medical help as quickly as you can. Early diagnosis and treatment can make a difference. Your medical provider can provide not only with a diagnosis, but also to help you connect to treatment options. And please be careful about the internet providing spot cures, if you will. Please talk to your healthcare provider about any reports of cures or treatments that you've seen before you start them. Remember, if you have a condition that has multiple variables involved with it, it's unlikely that a single treatment is going to treat them all. So a lot going on with autism spectrum disorder. A lot of kids diagnosed with it. I'm sure all of you know some kids or people who have kids with ASD, but also a lot of unanswered questions. What causes it? Is it growing? Is it more common or simply being more commonly diagnosed? And what are the best treatments? There are good treatments. I encourage you to seek them out if you have any questions about whether your child or a child you know may have ASD. Please feel free to share this video with anyone who might be interested. Thanks as always to Dara Young for editing, producing, adding captions, and posting this video. And if you have any questions or comments about what I've said this week about autism or about any other emerging public health issue, please let me know. I look forward to hearing from you. Until next week, please be well.